Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at roselecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. What a beautiful day. It's absolutely stunning outside. Finally, spring has sprung. What a gorgeous time of the year. We should have had it a month ago, but nevertheless, enjoy the moment, be in the present time, and get outside and have a great afternoon after you listen to Dr. Tom Roselle Live. Absolutely. Perhaps you've had a problem and you've tried, you've applied, you've done everything you know what to do to kind of put the fire out. Nothing's worked, right? Well, here's your opportunity, and let me tell you how you do that. You're going to do it without drugs, without surgery, the natural way, the way your body was designed to make that happen. That's why we do this program. That's why we're here for you. Give us a call, 888-630-9625. That's 888-630-9625. We have a topic today, one that's very interesting, and it's going to be the topic that we're going to present at the Roselle Center for Healing in our continuing education program this Wednesday evening, the 30th of the month, 7:30 p.m. And what's that topic? It's called autoimmune disorders or autoimmune conditions. And to help me go through that is somebody who is amazingly capable and able and bright in the subject area, Dr. Leonard Poe. Dr. Poe, good afternoon.
Good afternoon.
Glad you're here. We're going to talk about a subject that, covers a lot of different areas, a lot of different territories. We could talk about Sjogren's, we could talk about lupus, we could talk about Addison's disease, we can talk about Hashimoto's thyroiditis, any of those things, and the list really goes on. So what I want to start with, and we need to kind of set the stage for this so people really understand that, number one, where this stuff comes from, why autoimmune problems, what an autoimmune problem is, but more importantly, I want to have them understand that there's a fix, but let's start with what are autoimmune conditions opposed to functional conditions, opposed to a bacterial infection, opposed to, what does that really mean?
Right. Well, when we talk about autoimmune diseases, what we're really talking about is your immune system and the fact that your immune system has now designated certain tissues within your body for destruction, just like it would a bacteria or a virus or a parasite or any other kind of infectious disease you might get. So, for example, something like you mentioned Hashimoto's thyroiditis, which is an autoimmune disease of the thyroid. It's selected certain proteins or enzymes within the thyroid, thinking that it's some sort of foreign body, it's a foreign invader, we need to destroy this. And so the immune system sets off on trying to destroy that. And the repercussions of that particular one is that you see thyroid function start to decrease over time. But it can be any tissue, and that's why we have so many different types of autoimmune disease.
The cascade, if you will, in autoimmune types of problems, we've talked about lupus, scleroderma, all these things. Is there a common link in these problems? Is there something that you can say in any autoimmune condition, regardless of what the problem is, this happens to start first?
Sure, and that's really the basis of how we look at it from a functional medicine perspective to begin with. The name of the disease really just designates which tissue is being affected, and that's all. The mechanics behind that from an immune system standpoint is really the same. The beginning cascade, how it starts, what happens, which immune cells get activated, which ones aren't being activated, all that is pretty much the same across the board for all of them. So the name of the disease is just which tissue is being attacked, and that's pretty much it. But from a functional standpoint, all of them are pretty much the same.
So when we talk about all of them being the same, and we know that in very severe conditions, we have patients who are been told that they don't have a lot of time left, that their organ systems are breaking down, that their bones are brittle and they're degenerating. Each one of these problems has an underlying, and I'm going to interject this, obviously, an underlying platform, and that platform, I think, comes from, and correct me, if we need to go in a different direction with this, is simply, and I know you will, is, when there is a repetitive stress pattern to the body, either from something affecting the nervous system, and it could have been an old injury pattern of some sort that just never went away, or constant repetitive injury, biochemistry, a constant exposure to things that shouldn't be in the body, or environmental garbage, or, in living in Washington, D.C., we have stress that most parts of this world don't have.
No, you left it open up. I'll agree with you.
Thanks. We'll put that down as a day in history.
No, but that's a pretty true statement. I mean, the way this really starts is constant irritation to the immune system in ways that it just shouldn't be constantly irritated. Lots of underlying things. You talk about one of the big things that I'm starting to see with a lot of these patients. I know you are as well. In this area, in the East Coast, but really, across the U.S., one of those real easy underlying circumstances these days is Lyme disease. I mean, I see that mixed in with it lots of times, and that's just one example. But it can be anything that's constantly irritating the neuroimmune system to try to fix things in the body, to try to go after things, and it just starts to mistake your tissue for those things it wants to destroy.
Before Lyme's, the big bugaboo was chronic fatigue syndrome, and it was the Epstein-Barr virus that was in the body. And the truth of it was that if you did a full sampling of 100% of the population above age of 21, everyone has the antibody to EBV. You've been exposed to it at one point in your life. Doesn't mean you're going to get sick. So here's where we have this autoimmune cascade, and that's, if you will.
Yeah, and that's important to bring up because, just because you have those antibodies present doesn't mean that it's an active disease. And that's important to realize with that.
888-630-9625. 888-630-9625. Love to talk to you on this subject or any other subject. My guest in studio, Dr. Leonard Poe, your host and presenter this Wednesday evening, the 30th of April, at the Rosale Center for Healing in Fairfax. We're just off the National Capital Beltway. We'd love to have you as our guest. Trust me, you will learn a great deal. If you're suffering from an autoimmune reaction, no matter what it is, if your doctor says this is one of those things that's going to get worse, think again, because truth of it is that after 37 years of practice and the hundreds of thousands of patients that we've treated over many years, we don't see it that way, and there's a whole lot that can be done. Love to have you. All you need to do to come to that class is give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to register for Dr. Leonard Poe's presentation on autoimmune disorders and what they are. Dr. Poe, let's get into this a little deeper and kind of let's take it apart from a level of understanding. One of the areas I know that you have special interest in is thyroid problems. And we talked a little bit about Hashimoto's thyroiditis, and we know that it's an autoimmune process within the body. We're not going to focus on thyroid problems, but how does this become an autoimmune condition opposed to somebody who just has a sluggish thyroid?
Okay. So we just want to separate out for right now the difference between functional thyroid or functional hypothyroid, either primary or secondary, versus Hashimoto's.
Yeah, why the autoimmune situation? We know that the majority of patients are diagnosed with hypothyroid today. Probably about 60% plus of them are Hashimoto's. Well,
I'd say higher than that, but yeah,
I'm being kind.
Yeah, the difference is you can have a sluggish thyroid, or you can have primary or secondary hypothyroidism for lots of different reasons. It can be a protein deficiency. It can be an iodine deficiency. I mean, there's lots of reasons, and it usually has to do with just real simple nutritional pieces that just you don't have those base pieces you need to make the hormone. With Hashimoto's, and this is where you have to really start looking at, okay, what's this disease that I have? And that's why I said don't worry about the name so much. because that's just affecting the target tissue. When you have Hashimoto's, you don't necessarily have a thyroid problem. Doesn't mean that the thyroid's not working correctly. It means that the immune system is constantly attacking it. It's destroying tissue within the thyroid. And as it does that, you produce less and less hormone. So over time, as you lose more of that thyroid, you lose the ability to make as much hormone as your body needs.
And, going back to our old friend that we kind of tie into so many different conditions, but in this particular subject area, autoimmune dysfunction disorders, it's very true, and what we're talking about is the inflammatory cascade that occurs from stressors, if you will, in our environment, and stressors can be things that we're sensitive to. We know that foods today particularly have been poisoned, and I use that term because there's so many countries throughout the world that will not accept U.S. manufactured foods.
No, it's true. We put so many additives in there that are banned in lots of countries.
I mean, we have BHA and so forth, and you can't.
I think that's banned in China.
That's right. And when you say China, who has arsenic virtually in everything,
and lead,
and they're saying no, we're not taking your goods. It tells you something about our environment and the things that we have here. They won't take our beef.
Yeah.
Because of the steroids and the growth hormone and the antibiotics. But we're putting those things into our bodies.
And that's the problem. And this is really where the whole cascade begins. Because, and if you go through and you read some of the journals in immunology, I mean, all the immunologists are saying now that, something called leaky gut syndrome is really a prerequisite for this. But any chronic irritation to any of those barrier systems, whether we're talking about your skin, we're talking about the blood-brain barrier, we're talking about the gastrointestinal tract, the bladder, any of those things, when they're constantly being bombarded and irritated and upset where the immune system's trying to engage, and you get breakdown, that's how we start in that cascade towards mistaking our own tissues for antibodies or for pathogens and making antibodies to them.
We have a couple of minutes before the break. Let's talk about something that we see on television all the time, and rheumatoid arthritis or psoriatic arthritis. Both of these, by definition, if you look them up, are autoimmune conditions.
Right.
And they attack the body, particularly the structural system. Mm-hmm. But in fact, they're attacking many other systems as well. It's just not about the joint spaces.
Right.
So how does that happen? You have patients. I have rheumatoid. Take this drug for this. I have psoriatic arthritis. Take this drug for that. But they're further suppressing the immune reaction to control it.
Right. That's the problem. It's you're gonna drag me into a very complicated.
Yes.
Okay.
Try to see if you can explain it to me.
Okay.
It works.
Part of the issue when you do that, part of the normal working immune system is to have certain cells that help suppress the immune function. Okay, so they help turn off when we're having too much autodestruction. And that's part of what gets stuck in an autoimmune flare-up is those suppressor cells are too low and they can't turn off the cascade. And so when you do things that are constantly suppressing the immune system, you're not doing anything to really help the immune system be able to self-correct itself. And over time, it gets worse and worse and worse.
And it truly begins to eat tissue. I mean, you see patients, we have patients that come in and
it destroys the tissue, absolutely.
You have ankylosing spondylitis, for example. And what that means is that the spine fuses together. And if you look at an x-ray, it looks almost like a candle wax effect. Each segment, and you almost can't tell which segment is separate from the other. But we know that in ankylosing problems, it is an autoimmune condition.
Right.
But it comes from the intestinal tract.
Right.
And because the gut, going back to what you said.
Same thing with psoriatic arthritis.
Yes.
Or if you want to call it enteropathic arthritis. I mean, it goes back to the gut.
And we're talking about microorganisms.
Yeah.
And we're talking about all the stuff that we get from our environment and that has never really had any attention paid to it. So somebody comes into our practice and we do these stool tests and we do all these other environmental ecological diagnostics, meaning we want to know what's going on inside of you. And then we say, the reason that you have this is because of this, and the medication that you're taking that suppresses your immune reaction is actually making this worse. And I know it's a dog chasing his tail, but that's the way medicine works. And I want to get into that a little bit more in depth when we come back from the break. It's important that people understand that this is a body under siege, and it's under siege because of the things that have happened to it, about it, around it, and the stress patterns, and we'll talk more about that. We'll be right back after some important messages.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yes, we're in studio on this absolutely stunning, beautiful Washington day. Waiting for your phone calls at 888-630-9625. That's 888-630-9625. My guest in studio, your host, your presenter, this Wednesday evening at the Rosale Center for Healing, the Wednesday the 30th, 7:30 p.m. What is he going to talk about? Autoimmune. Who is he? Dr. Leonard Poe. Love to have you as our guest. And if you have any kind of autoimmune condition, and if you look up, there's probably well in excess of 80 of them that are listed, and there's more than that. These things affecting every tissue in your body.
And well more suspected, too.
And well more suspected. And it's one of those things. One is let you save a date in close. Got two dates I want you to save. One is in October 18th. It's going to be our all-day event that many of you have attended, and you know it's over the top relative to information. It starts early in the morning, goes late in the day. Go online within the next 2 weeks, and you'll be able to purchase tickets and save a whole lot of money. In addition to that, next Sunday, May the 4th, we're going to be at the AFI Studio Theater in Silver Spring, Maryland. Why? Because you can have an opportunity to finally view, if you haven't before, the PBS special 2 times Emmy Award film, Ageless Health. You want to see 6 people who had been given up for all kinds of problems? Well, this is an opportunity, and these are people that in a couple different situations have had serious autoimmune conditions. If you'd like to join us this Wednesday evening, again, all you need to do is call 703-698-7117, 703-698-7117. Tell my staff that you'd like to be there. I want to go to the phones, and then we're going to get back on topic. Actually, this is on topic, so that's why I want to go to the phone. Kurt, thank you for holding, and thank you for being patient. How can I help you, sir?
Yeah, hi. I've had for a long, long time this rash, sort of this itchy redness, and then also real dried. You know, when I drink a lot of water, it helps, but it's.
Where is it on your foot? Is it in between your toes?
It's on the lower right, below my ankle, but above my heel, and then it's, of course, my heel is really dried and cracked up, and I do everything. I put everything on it, glycerin, and the doctor gave me this triazonone, and you went to 2 tubes of that. It didn't do a damn thing.
No, it probably doesn't. So here's the deal. That could be, without seeing it, it could be a lot of different things. Are your nails on your feet thick?
Oh, nails are perfect.
The nails are fine?
Yeah.
Okay. So that's an atypical fungal type of condition. Generally, when you get fungal problems on the foot, it's often going to affect the nails. The nails get thick, they get hard, they lift, and so forth. To have the type of rashing, now it's on both feet?
Well, no, just mostly this one foot.
Okay, is it
and also on the top of my top of my toes a little bit too. Got that rough, scabby, dried out.
The chances are you're talking about a fungal type of condition. It's rare that it doesn't affect the toenails, but it's right in line with what we're talking about in an autoimmune condition. If it is, and again, I don't know that it is, but let's assume that it is because your doctor probably told you that's what it is, and based on the medication that he's given you, my gut level is that's what he thinks it is. But here's the deal. It's your internal environment that is going to continue to perpetuate the problem. When the body when it becomes sweet and wet, then you grow mold, just like mushrooms out in the woods, okay? So if the environment has a real deep, loamy texture to it, and then it's wet and damp and not a lot of sunlight, guess what happens? You start growing mushrooms all over the place. The body reacts to things. I'm just going to give you a cascade, Kurt. Sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, junk. Basically, when you eat an animal product, when you eat a piece of meat or chicken or anything like that, those animals have been injected. Unless they're free-range organic animals, they've been injected with antibiotics. Guess what happens? That goes into your system and knocks out the good bacteria, and now you fulminate. If you drink it all, particularly wine and beer, those are fermented. If you like peanuts and peanut butter, it's going to make it worse. If you have a sweet tooth, it's going to make it worse. For that to go away, you've got to eliminate. That's where you start. You've got to stop that sort of situation. There's a lot of things that you can take, but you're basically playing. I can give you nutritional products, but you're going to play medicine with nutrition. Not that they're not necessary, but you got to change the underlying substrate, if you will, the environment, and those things have to be eliminated. So you have to look at the diet. Your diet needs to go to clean proteins, lots and lots of vegetables, staying away from the fast-acting carbohydrates, and allow your body to basically reform its status. Kurt, I've got to take a break. Thank you for your phone call. I hope that was somewhat useful to you. We'll be right back after these messages.
Educate, engage, empower. Take control of your health with Dr. Tom Rosale and the Rosale Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Rosale's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomrosale.com/education. That's drtomrosale.com/education. Join Dr. Tom Rosale for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Rosale Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Rosale. You're listening to Dr. Tom Rosale Live. Yes, we're in studio. Give us a call, 888-630-9625. That's 888-630-9625. My guest today, your presenter this Wednesday evening, Dr. Leonard Poe, is going to be talking about autoimmune diseases, and that's what we're kind of chatting about right now. And we're going to get back into the subject. If you'd like to join him and come down to the practice and have your questions answered, if you have any kind of autoimmune reaction, this is an opportunity for you to really learn something that might work, whether it's a hepatitis problem, whether it's celiac disease, whether it's a lupus or Sjogren's or a degenerative arthritic condition, a rheumatoid, or any of the things we've been talking about. You can put the fire out. You don't have to live with this. Your body's extraordinarily forgiving. And unfortunately, the more medications that you're taking, the further suppressed your body's going to become. Give us a call at 703-698-7117. Tell them that you'd like to join us and join Dr. Poe this Wednesday evening.
Or even if you just want to try to get a handle on how to avoid this. There was a study, I want to say it was in Italy, about 5 years ago, where they measured, they were trying to pull information on centurions, people that live to be 100. And one of the common factors that they found in these people is none of them had any kind of autoimmune antibodies that they could find. So it's certainly something that we see that's prevalent in society. It's growing. So you want to do everything you can possible to try to avoid picking up these things.
I was going to say because of garlic, olive oil, and red wine.
That's got to be it. That's the key.
That has to be
obviously
the key. Coming from first generation Sicilian, it has to be that. And I was told that from never mind. So let's talk a little bit about the process.
Or maybe the lack of stress too.
Yeah, that's probably it more than anything else. You sit back, you relax, you get on the mountaintop, you look at the seas, you look at the water, you let the shore come in and out, you look at the beautiful skies, uninterrupted by
if you can live like that, and I'm not saying I'm for it, but if you can live like that, a couple vices don't even start to flake in there too much.
That's true.
The stress is really what kills us.
It's true. Absolutely across the board. So let's talk a little bit about, let's take a problem like inflammatory bowel disease. Okay? And because this is going to lead us into what Monsanto and his brothers are doing now. And we have a lot of intestinal permeability, which means that things absorb not as well digested as they're supposed to into the body. The body goes into an alarm stage. Inflammatory levels go through the ceiling. So take us through that. Why do we have to worry so much about what it is that we put in our mouth, particularly as it goes to what I'm alluding to?
Well, because like I said earlier, I mean, really where we see the influx of this is when that gut becomes leaky, when it starts to break down. And let's face it, none of us digest food well because none of us are eating what we're really supposed to eat in the first place. You get either undigested food in the gut that's sitting in there, rotting, irritating the tissue. You get bacteria in there. You get mold and fungus in there, parasites, all the sorts of stuff that we pick up. And believe me, if you think that's rare, I mean, I see it more often than not on stool testing. I mean, people have that stuff in their guts, and nobody's really an exception. So if that stuff's all in there and it's irritating it, it's breaking down the tissue, you start to get gaps in that tissue, and that's when those whole proteins can start to leak out. They leak into your body, and the immune system says, hey, this shouldn't be here. This is a foreign body. Let's go ahead and attack it. And they go about, they set up an immune response, they attack this thing. But unfortunately, some of those whole proteins that have leaked into your system, they look like other proteins in your body. And when the immune system is constantly besieged, then it starts to say, okay, we're not going to be as selective about what we go after here. If it kind of looks the same, we're going to go ahead and attack it. And so it sees some of your tissue and says, hey, that looks about the same. Let's go ahead and attack this. And then once you start making antibodies to that, that's you're making antibodies. And now the immune system wants to go ahead and try to destroy this tissue.
This Wednesday evening, the 30th of the month, Dr. Leonard Poe is going to be your host, your presenter at the Rosale Center for Healing, 7:30 p.m., talking about what we're talking about now, autoimmune disorders and conditions. Love to have you as a guest. Give our office a call, 703-698-7117. There's no reason to suffer with this stuff. You could make a huge difference in your life. We have case after case after case where people really step up to the plate and do what they need to do. Ruth, you've been holding very, very patiently. How can I help you?
Thank you, Dr. Roselle and Dr. Poe. Doctor, I have just two short questions. Why is diabetes type 2 sometimes thought of as an autoimmune disease? And the second question I'll ask.
Okay, well,
with the first one, you see this quite frequently, actually. I think about last statistics I looked at, it was about a third of the time type 2 diabetes is actually what they call type 1.5, which is an autoimmune problem, where typically, and there's a couple different antibodies that can be involved, but your immune system is now making antibodies. Probably the big one is called GAD, but it's making antibodies towards this GAD enzyme that lives in the pancreas. And when it goes after and destroys it, it destroys some of the pancreas, and then you can't make insulin quite as well as you should. And these are patients that we see that, their diet's really good. They're eating the right things. I mean, they're eating in the amount of time that they should. They're not going long periods without eating and getting these insulin surges. They're really doing all the right things dietarily. They're not obese. They exercise, but they're still having these problems with blood sugar. And that's when you go in, you start to look at some of these things. And like I said, it's about a third of the time that we're seeing now with adults. It ties in a lot with thyroid autoimmune problems as well. It's the same gene base.
Ruth, second part of the question.
Yes. The other questions, I read in a health magazine that 1 egg a day might be helpful in stabilizing your blood sugar with diabetes, but then the second paragraph seemed to contradict that advice, and I wonder what that is all about.
Okay, very quickly, there's a lot of bad press out on eggs. There was an article that was published in New England Journal of Medicine that was really very curious to a lot of people, and it basically said that there's no relationship between, first, eggs and heart disease. There was a guy that they reported that ate 25 eggs a day and had totally normal cholesterol levels. So it has to do with a lot of other things, but primarily liver metabolism. Now, having said that, if you eat an egg that is not fried, and it's either poached or hard-boiled, soft-boiled.
Better,
you're right, totally better, and slightly soft-boiled, it has something called biotinase that actually makes it a perfect protein. And when that happens, you balance your blood sugars. You, as a diabetic, any diabetic, needs high levels of protein, low levels of carbohydrates, and exercise. And if you did those two things and increase the antioxidant levels in the body, you actually keep blood sugars way under control. So, it goes also within the realm of what we're talking about with the inflammatory cascade. But eggs are a perfect protein if they're soft-boiled and no more than a couple minutes.
And the yolk itself is really high in something called phosphatidylserine, which has a profound effect on hypothalamic function in the brain, which cascades down to really controlling a lot of the pituitary values, the endocrine values. So that goes a long way, too, and not only cortisol levels and stress, but also things like regulating insulin and blood sugar levels.
Thank you so much.
Ruth, I hope that helps you very much. Barbara, how can we be of help to you? Barbara.
Hello?
Hi, how can we help you?
What do you know about enlarged red blood cells and how that condition can affect someone's health?
Oh, you have about an hour or two or three. We can talk about this and make this the whole program. Seriously, all kidding aside, red blood cells enlarge for a lot of reasons. There's something called a macrocytic anemia or something called macrocytosis, and that all has to do with red blood cells, and it means that they've gotten bigger. They get bigger for a lot of reasons. One is that your levels of B12 and folic acid are low, or they're not being transported into tissue. Subsequently, the red blood cells are going to get larger. If you're not able to transport or not getting enough nutrients, the body kind of fail-safes and enlarges and tries to transport a lot of different nutrient bases into the system. What's important to understand here is the reason that they enlarge is trying to get something called hemoglobin, which carries oxygen and so forth into tissue, and the body's not doing a really good job of it. So if you have a B12 deficiency, that's the most common situation. And
iron deficiency as well.
Iron deficiency.
Or mixed.
Yeah, it'll be a mixed process that would cause that. So you have to look at that. Even though your levels on blood testing may be normal, it doesn't mean that you're getting it into the tissue.
Yeah, you've got to look at the functional ranges for that blood work. You got to understand those ranges that you see off to the side are statistical. So when you look at things like hemoglobin, you look at things like your iron level, they can be functionally low, and you can have some functional anemia, but it doesn't show up that way on the blood work. So you have to be careful about, the way you interpret that. The other thing that, if they're chronically, if your red cell distribution width like that is chronically high, you want to make sure you don't have any kind of bleeding going on, any kind of internal bleeding. So that could be something as simple as ulcerations in the intestinal tract, which would come. A lot of people have those. If you have things like H. pylori, which is a bacterial infection that can cause that. 50% of the world's population has it. So you want to rule out things like that as well. If you get the anemias out of the way and you still can't get it down.
Then you start looking at other things. But this is one of those situations that you may have heard the term or have heard me say it. When you hear hoofbeats, you look for horses, not zebras. You look for the most common thing first. There are rare situations, but I'm not going to throw those on the table because I don't know a whole lot about you. I don't know the rest of your blood work. But the most common situations are what we talked about right now. Barbara, I appreciate your phone call. Thank you so very much. Bernice, thank you for holding. How can we help you?
Yeah, I have a friend. She's 86, and she is using, it's called, let me see, I don't know how to say this. Hold on, I just, okay, ALPEHAGAN. Alpehagan? I don't know, for eyes, for glaucoma. And then, is there anything natural she can do?
Well, it depends on what's causing the glaucoma. The glaucoma is pressure.
Okay,
and
she said left angle glaucoma.
Okay, well, that doesn't mean anything. Okay, it's just, let's take glaucoma to begin with, and that means that there's interocular pressure. Uh-huh. From our point of view, interocular pressure can come about from past traumas or blows to the head. It can come as a result of the temporomandibular joint not sitting the way it's supposed to. The mandible, as it opens and closes, as you open and close your mouth, is the pump handle for the 22 bones that make up the skull and that moves the spinal fluid. So if there was a past trauma, maybe even years ago, if somebody sneezes and has a habit of holding their breath when they sneeze, they can lock up these cranial sutures, and the spinal fluid is not going to move. When it doesn't move as easily and as fluidly as it's supposed to, you get pressure within the cranial plates. Subsequently, they can affect the orbits of the eye. The nerves from the brainstem go to that portion of the eye, and if they're not firing the way they're supposed to, pressure can build up. So there's a whole lot of reason there. Again, Bernice, you're calling from Arizona, and thank you for listening. What I would do is that there are, again, some really excellent people out there that could help you. If if you were here or whoever's having the problem, we're in the area, the first thing that we're checking is the position of the cranial plates. The next thing that we're going to check is blood pressure as it is influenced by different positional types of situations. We're going to check all of that and see if there's problems. Inflammatory reactions due to allergens can also cause a glucomic pattern. Now, once damage is done and it's affecting the different visual fields, you're at a place where you start seeing things break down. But again, you find what the problem is, you fix the problem as much as you possibly can. Is it all treatable? It can be all treatable. It depends on how treatable is it. Can you totally tone it around? It depends on where it is and where the stage of the game is. Stress has a lot to do with that as well. Talk to me offline or send me a note at drtomrosale.com, and I'll give you some other guidance.
Okay, thank you.
Thank you so very much. I appreciate it. 888-630-9625. That's how you find us here. This Wednesday evening, the 30th of the month, Dr. Leonard Poe is going to be presenting Autoimmune Disorders and Conditions. And listen, if you have any problem like that, if you're on medications that you know that are immunological suppressives, this is an opportunity for you to really get the skinny on it and find out what you can do. As you know, this guy knows his stuff, and he can really give you the tweak on it. Call us, 703-698-7117, 703-698-7117. He'll be there to answer your questions privately as well. Let's get into depth on this a little bit more, Dr. Poe, and talk about things like we've been in the gut. We talked a little bit about immune reactions stemming from there because of a lot of the foods that we eat, particularly genetically modified things and gluten products and the like, and that obviously causes all kinds of problems. But let's talk about inflammatory conditions that can affect the neurological pathways in the body. Everything from even mental acuity to the ability to process information, recall, that sort of thing. How does that happen? Because I know it's out there. Yes.
Close it down a little bit for me. What's the question?
Okay, so the question is, what are the problems that cause inflammatory reactions to occur, that cause, and a lot of studies out there now are...
All right, let's talk about I'm going to cut you off. Let's talk about the blood-brain barrier then.
Okay. That's an autoimmune
problem. Because we talked about the intestinal tract, and that's a big segue in. The other big place that we see with patients, too, is a breakdown in that blood-brain barrier system. And I think you and I spoke about this last time I was on a little bit when we were talking about neurological diseases and neurological inflammation. You have a barrier system around the blood vessels in the brain that create this very selective, permeable atmosphere. So only little things that are supposed to can go from the body into the brain. Just like the gut, that system can get broken down. And the mechanics of breaking that down are almost the same thing. Gluten is a big thing that's notorious for that. But it allows natural inflammatory chemical mediators that are found in the body to leak over in the brain, and you get inflammation.
Hold that thought. We'll be right back after these messages. This is Dr. Tom Rosale. After 35 years of practice and almost 750,000 patient visits, the Rosale Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosalecare.com. This is Dr. Tom Rosale, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Rosale web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Rosale web store on Amazon.com today. Visit drtomrosale.com and click on Rosale web store. That's drtomrosale.com and click on Rosale web store.
Join Dr. Tom Rosale for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Welcome back. This is Dr. Tom Rosale. You're listening to Dr. Tom Rosale live. We've been in studio, always waiting to help you in any way that we possibly can. That's why we do the program. That's why we continue to practice. That's why we go out and lecture. That's why we do the things that we do. This Wednesday evening, the 30th of the month, Dr. Leonard Poe is going to be talking about autoimmune conditions. So if you have any problem, if you're on immunological suppressant drugs, you want to know how to get off it, you think that you're stuck having to take medications for the rest of your life, this is an opportunity that you may find out that you don't have to. There's a whole lot more that you can do that you haven't even thought about. What happens if you get, even 50% better because of information that you learned this Wednesday evening? Wow, what an impact, right? Call us, 703-698-7117, 703-698-7117. Remember, all these classes are our gift to you. It's our way of supporting everyone that we possibly can in their quest for the ultimate in wellness, which is your birthright. 703-698-7117. I want to take just a second, and I want to wish a couple people a very, very happy birthday. One, my daughter-in-law. Happy birthday, Vanessa. And another woman who is very near and dear to me, and one of these people that you can't do anything for. They just are a beauty of their own. Betty, happy birthday. Let's get back into the process and talk a little bit about what we're doing this Wednesday evening, Dr. Poe. Kind of take us through it.
Well, we're going to start off with a couple different things. One, we're going to talk about what autoimmune disease really is and get a good handle on that, and some of the different types of ones that are out there that you may or may not have heard of. But I really want to talk a lot about how do you fix this long term if you do have it, but then also what do you do to prevent it? Because a lot of that has to do with genetics and epigenetics and how those things are looked upon. So if you have it, if you have a disease and you have children, you want to know how to avoid that genetic expression for them. That's another big important piece. So we're going to talk about the whole gambit.
It's going to be an interesting night. It's one of those things that, again, I encourage you to do this. If you have a problem, don't let it sit. Don't think that you're stuck. Don't think that there's not a way that you can make it a whole lot better than what it is right now. We've had patients with Sjogren's. We've had patients with lupus. We've had patients with scleroderma. We've had tons, more than I want to think about, of Hashimoto's thyroiditis patients. And in so many cases, not only can you be helped, and some others totally reversed, but there's a way of doing that, and you need to have the information, and you have to be proactive, and you have to be part of the team. You have to be willing to step up to the plate, and that's the problem. So many people aren't willing to change, make modifications in their lifestyle. They get stuck, or they accept the hallucination that either what do you expect for your age, or you have to take these pills for the rest of your life, or, this is just what happens. Not necessarily so. This Wednesday evening, give us a call. We'd love to have you. The 30th of the month, 703-698-7117. And don't forget, May the 4th, we're going to be at the AFI Theater in Silver Springs. And we're going to be letting you have the opportunity to see Ageless Health. I'm not going to take the call, but Bernice, I know you're listening. You want to know about if it can be seen in Arizona. Actually, get a hold of me online, drtomrosale.com, and we might be able to make that happen for you there. But you can't do it online, unfortunately, not right now. This program goes way too fast. There's so many more of you that we'd like to get to and like to really get into your problems in depth. Perhaps, something will happen one of these days, and we'll be sitting here for 2 hours with you, maybe 3 hours, as this program should be. We'll see you next week. We'll see you this Wednesday evening. This is Dr. Tom Rosale. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of SOFTOUCH Dental Care and Dr. Michael Chung. SOFTOUCH Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.